Minister of Human Services and Social Security, Honorable Dr. Vindhya Prasad, today conducted a walk-through and assessment of the night shelter and the Family Enhancement Services Department. The minister informed that this is part of government's efforts to upgrade the services being offered to citizens utilizing public facilities for the vulnerable.
In keeping with the mandate to provide better services to vulnerable citizens, Minister of Human Services and Social Security Honorable Dr. Vindhya Prasad, accompanied by the ministry's permanent secretary Lauren Beard, conducted an assessment visit to the night shelter and the Family Enhancement Services Department. At the night shelter, the minister and her team were guided by administrative assistant at the shelter, Florence Bourne. With her focus on the people, Minister Prasad interacted with some of the residents who took the opportunity to highlight issues affecting them. 56-year-old David Jones is a visually impaired resident at the night shelter, who expressed his gratitude to the minister for listening to his concerns.
I feel great. I feel that she's going to do something that will be surprising to me, right? Because since I'm here in my life, as I said before, I never get a cent disability under my disability-ness, right? Under my sickness and so on, since I acknowledge that what I am diagnosed with and so on. And I think that she's going to look into it.
During the walkabout, the minister evaluated the kitchen area, sleeping quarters, sanitary block, and the recreational hall. These areas, she noted, need major enhancements.
The night shelter is a peculiar place in that people transition in and out of the night shelter. However, because they would have chosen to come to the night shelter because of their difficult circumstances, I think there needs to be much more done there. I've looked at it critically. There needs to be upgrading of facilities, more staff on board, and the residents themselves, as well as the staff, expressed a number of concerns. The residents would like to have things like medications and medical care in the facility because we're now operating on the new normal, which is the COVID pandemic.
Minister Prasad noted plans to have more facilities accessible for the residents at the shelter.
Some of them raise many things like public assistance, which the legislation does not allow. Others raise their NIS issues. So there are a number of issues. But what I have committed to do is the things that we can deal with at once. When it comes to upgrading some of the amenities, like having better mattresses, pillows, sheets, better food, because I looked at what they were given, and being from a medical background, we always know that the elderly have different health complaints. So as such, their needs will be different depending on if they're hypertensive, diabetic, or they have any other chronic disease condition.
The need for more programs and activities for the elderly was also identified.
The whole idea is to make the place uplifting. And even though some of them may be there for a short time, the whole environment should give them a feeling of appreciation, that there is care and concern. Things like the washroom facilities, ensuring that there are enough facilities available for people who are physically challenged, differently able, because as you know, they will require different facilities for bathing and for getting in and out, which are not there. So looking at the entire place with a very practical and holistic approach and making the necessary changes sooner rather than later.
She added the night shelter and other similar institutions are important and should reflect the interests of the government, which cares for all. The minister also touched on legislation governing benefits for the elderly. She also stressed that change is on the horizon.
The legislation as it stands now does not allow those who are in government institution to benefit from that. But looking at it outside of that and looking at it in terms of the population, the idea is to increase all of these benefits across the board so that they will be commensurate with the living realities out there. There are things that can happen right away, and I'm pretty sure they will be happening with the new budget, things like ensuring that the VAT is removed on utilities, and also that there are other avenues where those who are in the elderly population, especially if they have comorbidities, they can have other areas catered for, supplements, vitamins. Those are some of the recommendations I would be making. And their aids for walking, all of those things, whether VAT is reduced, they're given a special concession.
On to her second stop, the minister visited the Family Enhancement Services Department located in the Palms compound to assess services delivered to the public amid COVID-19.
With COVID, our services continuing, and are we putting the measures in place to ensure that things like training? You were able to listen to a lot of the young people and the issues that they're struggling with. So in addition to limited numbers of interventions where we do it in person, we also want to set up a virtual unit here where we can do a lot of our interface, intervention, and training. So that's the thinking behind this. And you probably heard me question intensively the family service, what it is. Because a lot of families out there are facing constraints, not only because of COVID-19, but the economic situation is staggering.
Senior Probation Officer with responsibility for the Family Enhancement section, Samantha Craig, said she's elated that the minister visited the department to properly lay out plans for the way forward.
Our mandate as the department is to engage families and do so through youth intervention. So we start with the youth and then we engage the family as an extension of our help to the family, to the youth as well.
For InfoHub, Ayana George.